and welcome everyone. Thank you for joining us for our webinar today. We are very pleased to have Laura Lackey-McCready, who will be doing her presentation on overdose recognition and response, Have a Plan. Without further ado, I will go ahead and turn it over to Laura, who can provide a little more of a background about herself and kick off the presentation. Laura?
Thank you, Becca. Hi, everybody. My name is Laura, and I am a nurse here at Hamilton County Public Health. I'm the Injury Prevention Coordinator for the Opiate Response and the Prescription Drug Overdose Program. I come here to Hamilton County Public Health from 16 years of nursing, predominantly in pediatrics, mostly in emergency department. So I bring that perspective as I talk to you guys today. I come here, as no surprise, presenting to you guys a pretty big problem that we're seeing across the country. This map that you see here highlights the problem as you see it. It starts in 2002 and goes across. As you see, the map should start working. See that my map is not progressing here. It's interesting. Well, anyway, so what you typically see if the animation was working appropriately on here, and I apologize, is that the activity with the opiate overdose starts kind of out along the borders of the United States and progresses in, and everything progressively gets darker and darker, and nothing actually lightens up from 2002 all the way up until today. There's been a lot of coverage in the media on addiction and overdoses. The Columbus Dispatch, which is the paper locally in Columbus, Ohio, November 29, 2016, had a headline that read that 1 in 9 heroin deaths across the United States actually was occurring in Ohio. There have been some pretty notable books that have been out in the media. Chasing the Scream, written by Johann Hari. Pretty interesting stuff. He's pretty, I would say that he's been kind of controversial at times, but an interesting read, talking about kind of the cultural phenomena behind drug abuse. Hillbilly Elegy most recently has come out and has talked about the Appalachian culture and the impact that drugs has had upon it, and then Dreamland, which really focuses on the drug impact that has occurred in Portsmouth, Ohio, which was really an interesting read, written by Sam Quinones. I recommend all three of those if anyone has the interest. The picture down there at the bottom is Prince, who most recently has passed away from a fentanyl overdose, both prescribed and illicit drugs. So drugs and culture presence is very much out there and in the community and is very obvious. The picture on the left is a pretty sad story out of East Liverpool, Ohio. Some folks may be aware of it. If you look closely on the left, there is a little boy in a car seat in the back of that SUV. And these photos were actually taken by the East Liverpool Police Department. And what had happened was someone had called 911 after they noticed that there was an SUV driving erratically and kind of slowly and then coming to a halt. When the police arrived on the scene, the car had stopped. There were 2 adult individuals who appeared to be unconscious in the front seats, and then this little boy was in the back. Those 2 adults in the front are actually the little boy's grandparents, and they have both had overdosed with opiates. And the little boy was just sitting in the back and staring at the police officers. So this was another one that hit the media and was a pretty big deal, very controversial again, discussion about whether or not the little boy's face had been appropriately displayed. Should he have been blurred out? Should he have been shown? Was that okay or not? Were his civil liberties violated or not? And that's sort of up to debate at this point still. The police chief of East Liverpool actually talked about this in a conference that I most recently attended and talked about how this was a conscious decision that he had made to publish these photos, understanding the plight that Child Protective Services in so many counties in the state of Ohio are under right now, that they are just inundated with sheer volume of kiddos who just don't have anywhere to go. because their parents, and then like this little guy, their grandparents are overdosing, and they need families and places to go. So this police chief really felt like this was an opportunity for him to convey how dire the situation had really gotten. So like it or not, agree with it or not, it was something that he really felt like he needed to do to talk about how horrible things had really gotten. This is a graph that displays unintentional overdose deaths in Hamilton County, kind of starting in 2007 and then going all the way up through what we project the overdose death rates will be for 2016. At this point, we do not have solid numbers for what the 2016 OD rates for deaths look like. There's about a 90-day lag in toxicology that comes through the state, just because it takes so long for those labs to come through and be processed and finalized and placed on the death records. So what's interesting, and this is the one slide on here that kind of gives me hope, and I hope that you guys can all see this too, and I hope I convey it well to you, is you can see how the trends all continue to climb for opioids, for heroin, for synthetic narcotics. Everything climbs up through the years, from 2017 all the way up to 2015. And the thing that's interesting is in 2015 to 2016, it appears to be that there's going to be a dip, that things are actually going to decrease in terms of death rates. And this is where I feel that we have hope. And what we know is that in September of 2015, in Hamilton County, the health commissioner started an initiative that he felt very, very strongly that we needed to get Narcan out into the community, into the hands of first responders, into law enforcement's hands, into police officers' hands, into firefighters' hands, because we know that Narcan can save lives. And this is where we can start to see exactly what that Narcan has done. So this slide is showing that kind of glimmer of hope that even though overdose rates have continued to climb, the death rates have fallen. And so this is my hope, and this is what keeps me going every day, is knowing that we can help people, we can keep people alive, and we know that if we can keep Narcan out there on the streets and keep it in the hands of folks who need it the most, we can give people that second chance, that third chance, that fourth chance. Because you never know how many chances they might need to get into treatment, to decide that they want help. One thing I know for sure is I can't help anybody once they reach the coroner's office. So we have to help them before they get to that point. So this is my hope. This is the slide that I look at, and it makes me feel like there still is something that we can do. So this is a national trend that kind of shows where treatment has headed. You can kind of see the female and male patterns of deaths, and this is the national trend over the past basically 12, 13 years. Drug overdose death is currently the leading cause of accidental death in the U.S. with over 52,000 lethal drug overdoses in 2015 alone. A sad statistic is, for the first time in the U.S., life expectancy has declined in more than 20 years. This trend is believed to be attributed to the diseases of despair. Overdoses are included in there. Also included is alcoholism and suicide. So this is a trend that I hope that through public health and other initiatives like Narcan and syringe exchange and other work like that, that we can continue to push back on that and get that life expectancy back up. This is just a slide that highlights the fact that addiction and our families are in crisis. We've had dramatic increases in maternal opioid use and neonatal abstinence syndrome. We know that the mothers who are doing opiates while they're pregnant, that's having a significant impact on systems and a significant impact on the babies that are born. Every 25 minutes, a baby is born suffering from opioid withdrawal, which is a pretty sobering statistic when you think about it. This slide comes from a National Institute of Health slide. And we don't know the long-term sequelae of what happens to these little guys. You know, the crack babies of 20 years ago, the meth babies of 10 years ago, are now the heroin or the opiate babies of today. And over time, we will learn by watching them and figuring out what their developmental needs are, what their social needs will be, and what the impact will be on society and healthcare systems. We do know that they have an increased stay in hospitals, and we do know that there's an increased risk and an increased cost for healthcare. So we're kind of closely watching and monitoring this, but this is definitely something that children's hospitals and labor and delivery systems across the country are seeing a challenge in right now. These are just a few more slides to talk about the impact on our children. The top left is a slide from Cincinnati Children's that documents the uptick in emergency department and mental health visits and screenings that kind of coincides with the opiate use that we've seen in the past several years. And then in the bottom right, that shows the increase in children in custody in Job and Family Services. So these are the increased number of kids in foster care in Hamilton County that they believe can be attributed to the increase in opiate abuse in Hamilton County. There are not enough foster parents. There are not enough good, stable homes for kiddos to go to. So there's a constant scramble. There's a constant struggle to find safe, good placement for these kids. It creates it's an imbalance, and it creates a problem for schools. It creates a problem for families, for healthcare systems. So this is a lot. So just a little bit of background information on opioids. And you've heard a lot of folks just talking about heroin. So the reality is that at this point, we're not actually seeing a lot of heroin that's out on the streets. There's a lot more of the synthetics because they're simply just more cost-effective. They're cheaper to make. They're easier to make in a lab. So opioids are a class of drugs that include illicit drug heroin, as well as the prescription pain relievers oxycodone, hydrocodone, codeine, morphine, fentanyl, and others. Now, you see a lot of those in the list are actually available by prescription. There's a lot of regulations that have been put in place in the past several years through the United States government and then through the state of Ohio that have put pretty strict guidelines in terms of what physicians are allowed to prescribe and what pharmacists are allowed to dispense to physicians. So that's really cut back on the volume of pills that you see out on the streets. So in response to that, then, we've seen more illicit drugs and more illicit drug abuse out there in the community. Opioids are chemically related and interact with opioid receptors on nerve cells in the brain and in the nervous system, produce pleasurable effects and relieve pain. It's a feeling of euphoria and happiness, relief that they have. Addiction is a primary, chronic, and relapsing brain disease. This is a disease, guys. This is not a moral failing. This is not a choice, but this is a disease characterized by an individual pathologically pursuing reward and or relief by substance use and other behaviors. So this is the big piece that we're trying to get out into the community, is talking about brain chemistry and brain disease instead of choice, that we make sure folks understand that this is truly a disease and these folks truly deserve help within the medical system. So this just shows some treatment trends that have happened throughout the past several years, and you can show alcohol is on one line, cannabis, pot, whatever you want to call it, is on one line, cocaine, and then there's the opiate spike kind of trending way up there in black on the far right. So just to kind of show you that everything else has remained fairly static, and the trends have remained kind of steady where they've been. But the trend for opiates is pretty much off the train at this point. It's off the track, so it's way up there. So in spring of 2015, the Hamilton County Heroin Coalition was created. It's a partnership between county commissioners, public health, law enforcement, fire and EMS, mental health services, and then the Public Works Foundation here in town. And basically it was created around 4 key focus areas. They wanted to focus on prevention and public awareness, harm reduction, supply control, and then treatment. So prevention and public awareness is about educating the public, especially our youth, about the dangers of drug abuse, and then how to get help. Harm reduction is really the law enforcement side. That's where police and the sheriff's department get out there and kind of do investigations and look into what we can do to kind of get out there. I apologize, that's supply control. I'm talking ahead of myself. Harm reduction is the reduction of disease, so unintentional overdoses and deaths in the community. Harm reduction is syringe exchange, Narcan distribution, and then first responder responding to drug overdoses. Supply control is law enforcement. So that's partnership with local law enforcement, sheriff's staff, and it's reduction of supply on the streets to keep our neighborhoods and our families safe. We know that where there is a high supply of illicit drugs, we know that there's an increase in crime levels. So we know that supply control is important for several communities. And then treatment. We know that we need to work in prevention. We know that we need to reduce crime, and then we know that we need to reduce overdoses. But ultimately, we have to get a place to connect users and families to the help they need. And the treatment providers is where that needs to happen, in the hospitals and in healthcare settings. Inject Hope is a local website that we have here. It's actually reasonable and kind of a one-stop website where you can get information, get help, and get involved. If you access injecthope.com, you can go there and click on the county that you currently reside in. If you're outside of Hamilton County, click on your county and it will take you to the region that you work in, and you can kind of see the different resources that are available where you live. There's also the hotline that you can call for information, and then the report line that you can call in to report dealers if you're concerned about dealing in your area. And both of those numbers are listed. They're kind of small, but they're up there on your screen. This is a poster that kind of shows the community outreach effort that was done here at Hamilton County Public Health, and it talks about how drug addiction affects all Ohioans. These are actually visible in a lot of public spaces, most specifically in restrooms and kitchens and restaurants throughout the county. We know that overdoses in public restrooms occur quite frequently. So this was an initiative where we reached out to restaurants and other places like that and said, if you would put these out in your restaurants, put these out in your kitchens and let folks know, it just gives folks some warning signs and some things that they can be looking for. These are 2 sides of the daily overdose reports, and kind of gives you an idea of the level of daily kind of reporting and how closely we're watching the overdose activity every day. We watch hospital data, we watch county and city 911 data every morning, and then we map it out in the Hamilton County area to kind of give you an idea of the areas that are hardest hit. And based on this data, police and fire know where to deploy their resources. The police officers know where they should go out and look. The fire departments know where they can expect to be busiest. So these kind of reports are really important as we think about funding and resources and planning ahead. So as we kind of step back, we've talked about the whole county overall and what we need to think about as a community, but now some things that friends and loved ones can look out for when you're concerned about opioid abuse, or if you're thinking someone that you know or someone you love might have an abuse problem, have a problem with drugs or opioids. Some simple signs that friends and loved ones can look out for: their pupils will contract and be very, very small. You'll hear people describe them as being pinpoint. Their muscles will be slack or droopy. Their body can be kind of limp. They might nod out or seem sleepy at strange times that don't make any sense. When everybody else is wide awake and okay, they're falling asleep. In a loud room or when things are kind of really busy or chaotic, they'll nod off. They may scratch or be very itchy a lot, which is a side effect of opioids. That happens from the medication itself, so you may see them being very itchy. Their speech could be slurred. They might be out of it, but they'll respond to outside stimuli like loud noise or a light shake from a concerned friend. So if you reach over and tap them on the shoulder, if it seems like they're kind of nodding off at a strange time and you go, "Hey, are you okay?" and they kind of startle up a little bit and turn and look at you a little slowly, you might be a little concerned that maybe they have a problem. So if you are worried or concerned that someone is getting high, it's important that you never leave them alone during that time. If the person is still conscious, get up, walk them around, keep them awake, monitor their breathing. And if at any point you're worried and you don't think things are going well, if anything in your gut tells you otherwise, call for help. Call 911. So what does an actual overdose look like? So during an overdose, the individual will lose consciousness. They become unresponsive to outside stimuli. So that tap on the shoulder, that, "Hey, are you okay?" it doesn't work. Their breathing will become very slow and shallow, erratic, or will even stop. And that is the most important part of all of this, is when the breathing stops, the brain no longer receives oxygen. And that is not okay. That is not compatible with life. So that is what we have to worry about the most. For lighter-skinned folks, the skin will turn sort of a bluish purple, and for darker folks, it will be gray or sort of ashy. They may make choking sounds or a snore-like gurgling noise. You may have heard that as a death rattle before. Some people will vomit. Typically, the body goes very, very limp. The face is very pale and clammy, a little bit sweaty. Their fingernails and lips will turn blue or purplish black. And later on, their pulse or their heartbeat will become slow, erratic, or possibly not there at all. So this is a poster that's available online, but it's basically reviewing, talking about, do you recognize the signs of overdose? And it kind of starting up top and working your way down. Is their face clammy? Is their face gray? Is their body limp? Are they sleepy for no reason? Are they not breathing? Is their heartbeat slow? So there's a lot of really great resources online that you can find that you can kind of post up and put around, and these are really good reminders for folks if they need them. So if you're worried, if you're concerned, and you think that someone you love or someone you know, or you might be in an area where folks might overdose, have a plan and be ready. If you come across someone who you believe has overdosed, assess the scene. You need to watch out for sharp needles or even a fine white or gray powder. Some of the illicit drugs, the fentanyls out there, can be easily absorbed through the skin. So if you see any type of white powder, don't touch it. Just call 911. So second, call for help. Call 911 right away. If possible, have Narcan available and administer Narcan in the event of an overdose. We know that Narcan saves lives. Narcan is available at pharmacy counters around Hamilton County. You can get them at places like Kroger's, Walgreens, CVS. You do not need a prescription. You can bill your insurance for it if you have insurance. There is a cost if you do not want to bill your insurance. It is not free. If you know how, rescue breathing can help, and if they don't have a pulse, CPR will help if it's needed and if you're comfortable doing so. If you are not comfortable doing rescue breathing or CPR after you've administered the Narcan, the recovery position is the next thing you need to do. And essentially with the recovery position, you roll the individual on either side, left or right, it does not matter. Tuck their hands up under their head as if they're laying on their hands, and then bend one knee to keep them from rolling back onto their backs. Keeping them on their side is important and will protect their airway in the event that they do vomit or throw up. Frequently, folks, as they come back after they wake up a little bit with some Narcan, they will throw up. So having them side lying is very, very helpful. So this is where Narcan has a video that's actually very helpful. Okay. So we're actually going to share the screen so that you can see the video.
Ready?
Yep, hit it.
Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. Please see indications and important safety information at the end of this video. Also, please see accompanying full prescribing information in the use of this product. Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of Narcan nasal spray can help you save a life. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name. Kevin. Ask if he or she is okay. Hey, can you hear me? Check for signs of an overdose. Unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to get the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use the new Narcan nasal spray to give an additional dose in the other nostril. Acute opiate withdrawal symptoms may occur from use of Narcan nasal spray in patients who are opioid dependent. Symptoms include body aches, diarrhea, increased heart rate or tachycardia, fever, runny nose, sneezing, goosebumps, also known as piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, and increased blood pressure. When the emergency is over, put the Narcan nasal spray back in its box and throw it away in a place that is away from the reach of children. In addition to watching this video, please read the quick start guide that comes with Narcan nasal spray before using it. Talk to a healthcare professional if you have any questions about how to administer Narcan nasal spray. Please read the indications and important safety information that follows. Store Narcan nasal spray at room temperature between 59 to 77 degrees Fahrenheit, 15 to 25 degrees centigrade. Do not freeze Narcan nasal spray. Keep Narcan nasal spray in the box until ready to use. Replace Narcan nasal spray before the expiration date on the box. Keep Narcan nasal spray and all medicines out of the reach of children. Indications. Narcan naloxone hydrochloride nasal spray is an opioid antagonist indicated for the emergency treatment of known or suspected opioid overdose as manifested by respiratory and/or central nervous system depression. Narcan nasal spray is intended for immediate administration as emergency therapy in settings where opioids may be present. Narcan nasal spray is not a substitute for emergency medical care. Important safety information. Narcan nasal spray is contraindicated in patients known to be hypersensitive to naloxone hydrochloride. Seek emergency medical assistance immediately after initial use, keeping a patient under continued surveillance. Risk of recurrent respiratory and CNS depression. Due to the duration of action of naloxone relative to the opioid, keep the patient under continued surveillance and administer repeat doses of naloxone using a new nasal spray with each dose as necessary while awaiting emergency medical assistance. Risk of limited efficacy with partial agonists or mixed agonist-antagonist. Reversal of respiratory depression caused by partial agonists or mixed agonist-antagonists, such as buprenorphine and pentazocine, may be incomplete. Larger or repeat doses may be required. Precipitation of severe opioid withdrawal. Use in patients who are opioid dependent may precipitate opioid withdrawal, characterized by body aches, diarrhea, increased heart rate, tachycardia, fever, runny nose, sneezing, goosebumps, piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, and increased blood pressure. In neonates, opioid withdrawal may be life-threatening if not recognized and properly treated, and may be characterized by convulsions, excessive crying, and hyperactive reflexes. Monitor for the development of opioid withdrawal. Risk of cardiovascular, CV, effects. Abrupt postoperative reversal of opioid depression may result in adverse CV effects. These events have primarily occurred in patients who had pre-existing CV disorders or received other drugs that may have similar adverse CV effects. Monitor these patients closely in an appropriate healthcare setting after use of naloxone hydrochloride. The following adverse reactions were observed in a Narcan nasal spray clinical study. Increased blood pressure, musculoskeletal pain, headache, nasal dryness, nasal edema, nasal congestion, and nasal inflammation. See instructions for use and full prescribing information in the use of this product. To report suspected adverse reactions, contact Adapt Pharma Inc. at 1-844-4-NARCAN, 1-844-462-7226, or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.
Oh, it's that the screen's not showing. Okay. Sorry.
So we talked a little bit about harm reduction earlier, and we know that naloxone distribution, otherwise known as Narcan, does save lives. Bloodborne infectious disease prevention packages such as the syringe exchange also are very, very helpful in preventing the spread of HIV and hepatitis. Those are significantly on the climb here, especially locally here in Hamilton County and across the state of Ohio. So it's important to encourage those activities. And then we do have the Good Samaritan law here in Ohio, which protects individuals calling 911 from prosecution or arrest. prior to the Good Samaritan law, folks were basically afraid that if they called 911 to report an overdose, that they would be prosecuted or arrested. So they would run, and people would die instead of getting the help that they needed because their friends were calling 911. So this is encouraging folks to actually call 911 and get police, fire, and EMS to the scene to get people the help that they need. So this is just a graph that shows naloxone distribution and how aggressively we've kind of hit it since June of 2015 to March of 2017. And you can see that, obviously the bulk of it has gone out to fire and law enforcement. There have been some treatment providers. And then we do have Project Dawn, which is a project through the Ohio Department of Health that provides free doses of Narcan. And there should be some additional information on free doses of Narcan coming out in the future. If you keep an eye on Hamilton County Public Health's website, that should be coming in the next few weeks. So just a reminder that every day is a second chance for everyone. Narcan is just one way that we can give folks that second chance. So that's why it's so important that we keep Narcan out in the community and we keep folks aware of how to use it and when to call 911 and what to be watching out for. Coming up on August 31st is International Overdose Awareness Day. And they have a very simple tagline that I think is so important, and I would love to plaster this all over the place. But they essentially state that overdose can affect anyone, and it is so true. The concept of not in my neighborhood, not in my backyard, not in my family does not apply to opiates anymore. It is very difficult to find anyone who does not know someone who has been impacted by the horrible disease of addiction. So it is so very important that we stay on top of this. We continue to talk about this. Everyone have a plan, and you know how you would respond if you do think that someone has an addiction problem or if they do overdose. If you have any questions or if you'd like to talk at any point in time, this is my office information and my email. I'm available. Let me know your questions or your concerns. And thank you for your time.
Thank you, Laura, for your presentation. We really appreciate your time. For our audience members, we will be archiving the webinar and have it available on our We Thrive YouTube site for future listening. If you would like a copy of the PowerPoint presentation provided today, we can send it to you. Please reach out to Laura via her email that she provided or at contactwethrive@hamilton-co.org, and we'll be happy to provide that to you. Without any further ado, we'll go ahead and close the line. Thanks again.